As far as the work with Incredible Health, what would you say are some of the top takeaways that your team has had from the partnership so far?
Yeah, we've learned a lot, and that's really one of the things that I really enjoy is the data that's available to us on every aspect of the talent acquisition. And it's really, I have to be honest, I hadn't focused on it the way that I focus on it now until I was able to see the data on how we are bringing in talent and what the recruitment process is and the engagement of our team and how basically clunky we were in doing all of this. And until someone shows you the data of how long somebody sits in a queue or how long it takes to get to the hiring manager or the various, basically clunky processes that we have in place, and we lose candidates quickly because we weren't focused on speed. And still being able to hire somebody experienced, we've learned a lot and able to overlay what we use for our RNs then into other settings because it's the same team. So having a highly engaged HR team, a highly engaged recruiter is a great start and made a huge difference, particularly at Temecula Valley Hospital. But then you've got to engage the entire C-suite. And if you don't have the chief nursing officer really understanding the value of how we treat these candidates in the front end, and your CEO, then the whole thing falls apart again. So, we learned as we went on really having everyone understand the data and then getting that constant feedback of data. So I would know, for example, we were having a shortage of a particular area and I would ask, okay, what's the block? Well, the block was we weren't willing to hire from out of state. And that's huge because this is such an opportunity with the million nurses that you have across the country. And many of them were interested in coming to California, and yet we were saying no. And the reason for that was, the immediate gratification that I want to hire a nurse now and I want them to start tomorrow. And that's great. But we're still going to have that opening in 60 or 90 days because of the number of openings that we have. Let's hire for the future as well. And in particularly, unfortunately in California, it takes about that long to get a California license as an RN. So, it's that willingness to go ahead and hire, go through the process of them getting their RN license because you're going to have a great experienced nurse. It's just going to be in the future. So as soon as we started saying yes to that relocation and that out of state, that really opened things up for us. And we're going to need to do the same, absolutely, for the technicians and be willing to bring in from across the country and help individuals. And sometimes it takes longer to get that hire, but then you've got that great experienced individual and you're not just fishing in your same pond all the time and sharing technicians within, 8 different hospitals in your area. You're bringing in people who are relocating for other reasons, and you're able to get that experienced talent. So I'm really excited about the opportunity the success we've had at Temecula Valley Hospital with the RNs in really hard to fill specialties, being able to get an average of 8 years of experience for these nurses, in an ICU and a cardiac cath lab and these really difficult to fill areas is significant because otherwise we'd be doing, training programs and new graduate programs and new to specialty programs, which we will continue to do, but not to the level that we've had to because now we've got experienced nurses instead of always relying on that new graduate.
That's great. And then have you seen temporary labor costs come down as well on the nursing side?
Oh, yeah. We had, horrible peaks, as you can imagine, during COVID with traveling nurses and our reliance on premium labor. And we were beginning to make strides. And we would get down to, for example, at Temecula Valley Hospital, at one peak, we had 85 travelers. Now I believe they're down to 6 or 7, right. Just to give you an idea of how significantly we've been able to reduce that by bringing in, I think we're up to 30 RNs now that we've brought in with Incredible Health.
Great.